the face of Black maternal health. My name is Miasha. I am the mother of 6 beautiful children, 5 sons and 1 daughter. I was told I had a diagnosis of peripartum cardiomyopathy, or PPCM, which we know it to be, after I delivered my son. When I went into the hospital and I was on the ventilator for 3 days, not breathing on my own, when I awakened on that 3rd day and the doctors were talking to myself and my husband, that was the first time that I ever heard peripartum cardiomyopathy, or PPCM.
Peripartum cardiomyopathy is heart failure that develops during pregnancy and is the leading cause of maternal death. According to the College of Obstetrics and Gynecologists, or ACOG, it accounts for about 23% of deaths in the late postpartum period.
I think it's important to highlight that peripartum cardiomyopathy does disproportionately affect women of African descent, and as a result of that, we see higher and higher rates in Black women. We also notice that it's the leading cause of death after delivery. It typically occurs anywhere between 7 to 365 days after delivery. Signs and symptoms to look out for would be shortness of breath, chest pressure, weight gain, potentially feeling winded when you actually lay flat. So it's really important that you make sure that you speak to your healthcare professional, because of the fact that a lot of those symptoms could also be symptoms of pregnancy. And that healthcare professional, particularly the physician and the clinician, would be able to differentiate and do additional testing.
I am the face of Black maternal health. My name is Aryana, and I have a beautiful baby boy. With the postpartum preeclampsia, I never had any of those very typical symptoms they tell you to look for, the headache, the dizziness. For me, it was just an overwhelming feeling that something is not right in my body. I know this body, something is just not right.
It's important that if you don't feel right, and you know your body better than anybody else, it's important that you speak up and seek medical attention, because, again, preeclampsia is the great imitator, and it could be a life-threatening situation. You can have a normal delivery, and then preeclampsia presents itself in the postpartum period, typically up to 6 weeks postpartum. I call it the great imitator, because it can imitate a lot of other benign conditions that you may experience. For instance, if you have a headache, well, is that a migraine, or are you having a headache due to vasospasm in your brain? You're coughing, well, is this a cough, or are your lungs filling with fluid? Your abdomen hurts, well, is this gas? Or is this impending liver rupture? 53% of maternal deaths occur within 7 to 365 days after delivery. So this is a point in time that really needs to be taken seriously, and you really need to see your physician, particularly if you have any comorbid illnesses like hypertension.
My name is Maria, and I am the face of Black maternal health. I have an 18-month-old beautiful baby boy. We thought after the pregnancy hormones slowly but surely made their way out of my system that my blood pressure would come back down to normal. I was seeing the cardiologist, and my cardiologist was telling me that my numbers were fine, but I didn't feel fine. My numbers were in the 170s, sometimes the 180s, over the 110s to the 120s. And quite frankly, I didn't know if I was gonna be around to see my son's first birthday. It was really really scary.
I would say that Maria's story is not uncommon. Oftentimes, women, particularly during their pregnancy, especially women of color, feel as though they're not being listened to, they're not being heard, and they're not being believed. As a result of that, I would encourage everyone to make sure that if you're not receiving the care that you believe you should be receiving, you seek a second opinion. It's always important to get a second opinion and sometimes even a third opinion until you find that person who you can trust.
One of the last doctors that I saw from my care team was amazing, and she recommended me a different cardiologist. She said that she trusted this cardiologist with her mom, and for me, that's a recommendation that I trusted.
It has been established that patients want to be listened to and have time spent with them. Patients also desire relationship-based continuity of care that includes respect. That is a learning experience. The entire healthcare industry has to be receptive to provide what patients want and need.
I started seeing this new cardiologist, and within the first visit, she had done more for me than my previous doctor had done in over a year of managing my care, from the time that I was pregnant until about 7 months postpartum. She ordered me the tests that I needed, and she changed my medication to what I found out should have been the first line in defense for a medication. Ever since then, my blood pressure has been under control. I'm able to live my life without constant migraines and headaches, and I am internally and forever grateful to the doctor who gave me the recommendation.
Pregnant patients should be referred to cardiologists when they're deemed high risk by their obstetrician. Cardiologists should be consulted, preferably one who has cardio-obstetric training.